Critical colon cancer symptoms you should never ignore. Today we'll talk about colon cancer and its symptoms. Are there any critical symptoms of colon cancer that should never be ignored? Why are the rates of colon cancer rising, not just among the older population, but also increasingly in younger people? Let's delve into this concerning trend today and spark a meaningful discussion. Make sure to stick around until the end, as there's a list of the most common symptoms of colon cancer that you might be experiencing. Colon cancer is a growth of cells that begins in a part of the large intestine, called the colon. The colon is the first and longest part of the large intestine. The large intestine is the last part of the digestive system, which breaks down food for the body to use. Colon cancer typically affects older adults, though it can happen at any age. It usually begins as small clumps of cells called polyps that form inside the colon. Polyps generally aren't cancerous, but some can turn into colon cancers over time. If colon cancer develops, many treatments can help control it. Treatments include surgery, radiation therapy, and medicines such as chemotherapy, targeted therapy, and immunotherapy. Colon cancer is sometimes called colorectal cancer, a term that combines colon cancer and rectal cancer, which begins in the rectum. Colon cancer is one of the most devastating diseases today, ranking as the third most commonly diagnosed and the second most fatal type of cancer. What makes the fight against this disease even more complex is the formidable industry that has been built around it, driven by money, misleading ads, and so much confusing information, that it leaves both patients and healthcare professionals puzzled and often misinformed. There is a common misconception that your risk for colon cancer is mainly determined by your genetics. While it's true that having a family history can increase your risk, accounting for 5 to 10% of cases, this is far from the complete picture. Genes may load the gun, but it's our lifestyle choices that pull the trigger. In this context, modern research is increasingly highlighting the impact of diet and lifestyle as key factors in preventing or even reversing the disease. Foods rich in antioxidants, for instance, are now being acknowledged for their role in fighting various chronic conditions. This isn't just speculation, it's a rapidly growing area of scientific research that shows where medicine is headed in the future. How can you tell if you have colon cancer? What are the early symptoms of colon cancer? What symptoms indicate advanced stages of the disease? How can you detect it early? What exactly is a colonoscopy, and who should consider having one? What are intestinal polyps, and how can they be prevented from turning into cancer? Most importantly, are there natural ways to prevent and combat this condition? Contrary to what many believe, this type of cancer often goes undetected for a long time, sometimes years. Colon cancer typically begins as a small, slowly growing polyp on the intestinal wall, initially taking up minimal space, and not interfering with the contents of the intestines, which is why it doesn't produce symptoms in the early stages. Therefore, those at higher risk, especially individuals over 45 or 50, are advised to undergo a colonoscopy. The recommendation comes even earlier if you have first-degree relatives who have had cancer. With a colonoscopy, you can visualize, detect, and remove polyps. The appearance of symptoms often depends on both the size and location of the tumor. Interestingly, colon cancer growing on the right side of the intestine can be more elusive because the feces are still liquid at this stage. The intestine hasn't absorbed all the passing water yet. As a result, it's difficult for a tumor to obstruct the intestine at this point, unless it is very advanced or has metastasized to other organs like the liver, bones, or lungs. Let me offer a tip for early detection. Tumors often grow in an unorganized manner, leading to internal bleeding. Unfortunately, this bleeding is not visible. One method for early detection involves examining stool samples for hidden blood. A sample of stool is collected and sent to a laboratory for analysis. Colonoscopies are also effective for early detection. However, it's important to be aware of certain warning signs. For instance, chronic bleeding can lead to iron deficiency anemia. If someone around age 45 or 50 appears paler than usual and is experiencing iron deficiency anemia, they should be evaluated for an intestinal tumor. Sometimes stool may appear darker due to slightly more intense bleeding. Now, let's consider colon cancer that occurs on the left side of the intestine. Obstructions or blockages in the intestine occur earlier in this case because the feces are already solid and contain less water compared to the right side. So, what symptoms might a person experience? Before we delve into the following symptoms of colon cancer, don't forget to subscribe to our channel and turn on notifications to stay updated with our informative videos. A common symptom is a change in bowel habits. If your regular routine involves daily movements or once every 2 or 3 days, and you find yourself becoming constipated recently, not having bowel movements for 1 or 2 weeks, this should raise suspicion. In other cases, the shape of the fecal matter may change, becoming thinner as it passes through this area of the intestine. Alternatively, you could experience episodes of diarrhea, alternating with periods of constipation. Many people experience chronic diarrhea, which may prompt doctors to consider performing a colonoscopy to check for the presence of an intestinal tumor. When the tumor grows to an advanced stage, it produces an image on an X-ray that resembles a bitten apple. Specifically, this image shows the narrowing of the intestinal lumen due to the tumor, making it difficult for feces to pass through this narrowed section. Additionally, the tumor can cause visible bright red bleeding. Unlike the hidden bleeding in earlier stages, the stool may also appear darker due to the presence of blood. Similar to right-sided colon cancer, other symptoms indicative of more advanced cancer include abdominal pain from obstruction-induced gas buildup, abdominal swelling, weight loss, fatigue, and chronic tiredness. Symptoms could also manifest in internal organs, such as liver pain from metastasis, or shortness of breath if the lungs are affected. That's why the next information on how to detect this condition early, and most importantly, how to prevent it naturally, is crucial. What are intestinal polyps? These are generally benign small growths that hang like appendages from the wall of our intestine and are typically asymptomatic. The most effective way to detect polyps is through a colonoscopy. This procedure allows us not only to visualize the polyp, but also to remove it and send it for lab analysis to determine if it's benign or malignant. However, there's a catch. A small percentage of these benign polyps have the potential to develop into cancer over time. This video's main message is about the factors that can influence this transformation. As mentioned earlier, it is a combination of our genetic composition and our lifestyle habits. Contrary to previous beliefs, our genes are not fixed. Current research indicates that our dietary choices, from the food we buy to how we prepare it, play a crucial role in our overall health. A balanced diet, along with other healthy lifestyle habits, can impact gene expression, particularly genes linked to chronic inflammation, dementia, obesity, heart attacks, and cancer. Making healthier choices can reduce the activity of these genes, while poor dietary choices and unhealthy habits can accelerate their activity, potentially speeding up the growth of polyps and their transformation into tumors over time. Several factors contribute to the acceleration of this transformation, including ultra-processed foods, excessive consumption of processed red meats like sausages and salami, bad fats, excessive intake of vegetable oils, except for olive oil, sugar, and excessive sodium. These products, particularly when they come from ultra-processed foods, are like adding fuel to the fire for tumor growth. Ultra-processed foods have been officially recognized as carcinogenic for some time now. Other contributing factors include constipation, poor or inadequate intestinal flora or microbiota, and chronic inflammation. Additionally, habits such as alcohol consumption and smoking are also known to be carcinogenic. To lower the risk of colon cancer, it's important to follow a diet rich in anti-inflammatory and antioxidant foods. This includes consuming a variety of fruits and vegetables daily, as well as incorporating spices like turmeric for their anti-inflammatory and antioxidant benefits. Healthy fats, such as omega-3s found in fish like salmon, tuna, sardines, and anchovies, or in plant sources like chia, flaxseed, and sesame, are also recommended. Avocados and eggs from free-range chickens are other excellent sources of healthy fats. Addressing constipation is another way to reduce the risk of cancer, and consuming enough water and fiber can help with this, while also improving intestinal flora. Other healthy lifestyle choices that are often overlooked include getting enough sleep, exercising, and increasing social connections, all of which have antioxidant and anti-inflammatory effects. Foods like nuts and seeds, including pumpkin seeds, are also beneficial for intestinal health. Regarding diverticula and diverticulitis, it is now known that consuming seeds, nuts, and the hard outer coatings of some seeds and nuts does not increase the risk of these conditions or their complications, contrary to popular belief. In fact, they can improve intestinal flora and function, and may even help prevent colon cancer. However, individual evaluation is necessary for each case. So, if you have any intestinal issues, it's important to consult your doctor. Now, let's discuss colonoscopy, its purpose, and who should undergo it. A colonoscopy is a medical procedure used for the early detection of colon cancer. During this procedure, a long tube with a camera at its tip is inserted into the intestine through the anal region to search for abnormalities such as polyps, tumors, or lesions. If a polyp is found, it is removed and sent to a laboratory for analysis to determine if it's benign or malignant. The procedure is typically performed under sedation or mild anesthesia to ensure the patient's comfort, with most patients not experiencing any pain, and often not even remembering the procedure. It is generally recommended for individuals to start undergoing colonoscopies at the age of 45 or 50. However, if there is a family history of cancer, earlier screenings may be necessary. The usual frequency of subsequent procedures is every 10 years, unless advised otherwise by a doctor. While the procedure is generally safe, there are some risks to consider, such as bleeding or injury to the intestinal wall. Nonetheless, these risks are minimal, occurring in only 1 or 2 out of every 1,000 procedures. We hope you found this video helpful. If you have something to add, please share it with us in the comments section. Give this video a thumbs up and share the link with your family and best friends so they also will know the critical colon cancer symptoms that cannot be ignored. If you're new to our channel, don't forget to subscribe to support our growth. And hit the notification bell so you don't miss out on our next video. To learn more about preventing and safeguarding yourself against cancer, watch this additional video discussing 10 hidden signs of cancer that you should not ignore, particularly if you're a woman. Feel free to tap on this video on your screen right now. Thank you for watching. Bye.